Awareness has been reported even when measurable brain activity drops to near zero. This has been observed during deep anesthesia, cardiac arrest, and certain clinical shutdown states. In some cases, EEG readings show minimal or flat activity. Yet later, patients report perception. They describe sounds, voices, the sequence of events. This is not common, but it is documented. Modern neuroscience assumes awareness depends on active neural firing. When activity stops, experience should stop. But these cases challenge that assumption. During general anesthesia, drugs are designed to suppress consciousness by disrupting communication between brain regions. In most patients, this works completely. However, a small number later report awareness despite indicators that the brain was deeply suppressed. In cardiac arrest cases, cerebral blood flow drops rapidly. Electrical activity collapses within seconds. Clinical death is declared. Yet some patients later describe events that occurred during that window. These reports are controversial. They are difficult to verify, but they persist across decades, hospitals, and countries. One explanation is residual brain activity too subtle to measure. Another is brief reactivation during recovery that is later misattributed. Neither explanation fully accounts for all reports. In animal studies, consciousness-like responses have been observed even after major reductions in cortical activity. This suggests awareness may not depend on overall activity level alone, but on specific patterns or networks not yet fully understood. Current brain monitoring tools measure surface electrical signals. They do not capture all neural processes. They do not detect deeper or transient coordination. This leaves a gap between what is measured and what is experienced. Importantly, this does not imply the brain stops mattering. Damage still alters awareness. Drugs still suppress consciousness. But it suggests awareness may be more resilient and less tightly coupled to global activity than previously assumed. At present, neuroscience cannot explain how awareness can persist when standard indicators suggest it should not. Research continues. Models are being revised. Measurement tools are improving. But the mechanism remains unknown.